Well, hello. Today we're going to talk about the cervical lymphatic node and cervical sympathetic chain. First, we need to remember what are the functions of the lymphatic node. Remember, they are the guardians, they are the first wall against some pathologies like tumors, infection, inflammation. Okay. The first classification of the cervical lymphatic node was for Henry Rouvier, a French anatomist. In 1932, he made the first classification of the lymphatic nodes. Other more common classification, more surgical classification, is the classification of the 2002 American Academy of the Otorhinolaryngology. They divide in 7 groups. This is the most popular one, the one we use today. But we're gonna use another classification of the American Joint Committee of Cancer of the 2009. The American Journal Committee of Cancer. Okay, this is the classification we're gonna use for this presentation. So as you can see, we have between the classification of 2002, classification of 2009, there is a slight, very small difference. Okay. So first, we need to see the full scenario of how many lymphatic node space we're gonna have in the neck using the classification of 2009. So as you can see, we have 7 levels of classification in both. In 2002, 2009 is the same, almost the same. So we're gonna use seven levels. And you see the sternocleidomastoid is gonna be like the what we're gonna use for the divide, okay? To take like this this anterior, posterior, you remember the triangle of the neck. You remember a big triangle here, anterior triangle, and another big triangle there, posterior triangle. Always need to remember that. So we're gonna start now with the first level. The first level is submental and submandibular level. So you see, the limits we're gonna have is superiorly we're gonna have the myloioid muscle and the mandible. Okay, here myloioid and mandible. Inferiorly, we're gonna have the inferior border of the ioid bone. Anteriorly, platysma. Posteriorly, we're gonna have the posterior border of the submandibular gland. But okay, now we're gonna divide in level A and 1A and 1B. Wait, I know you're maybe gonna be saying, hey, and what happened with the gastric? Yes, we go now. So the level 1A or submental nodes, they are anteromedial between the anterior bellies of both the gastric muscles. Okay, anteromedial of both the gastric muscles. And 1B or submandibular node, they are posterolateral to the anterior belly of the digastric. Okay, only. So submentorial and submandibular. Good. Now, if we see the level 2 is the superior internal jugular chain, or they're in the deep cervical. Okay, what limits we gonna use there? Easy. So we're gonna use superiorly, or superior. We're gonna have the skull base at the jugular fossa. Inferiorly, we're gonna have the inferior border of the ioid bone. Ioid bone, skull base. Let's say skull base here. Anteriorly, we're gonna have the posterior border of the submandibular gland. posterior border of the submandibular gland. And posterolaterally, we're going to have the posterior border of the sternocleidomastoid muscle here. You see? Here. And medially, we're going to have the medial border of the internal carotid artery. So you see the limits here. You see the imaginary line. Okay. Also, this one gonna divide in 2A and 2B. The 2A, they are you cannot separate them from the anterior or the posterior edge of the internal jugular chains, include the jugulogastric nodal group. Okay, the posterior, the other group, the 2B, they are posterior to they are posteriorly, and you in this group, yes, you can separate this group by the fat plane from the internal jugular vein. So the 2A you cannot separate without injury the jugular vein, and 2B, yes, 2B, yes, absolutely you can separate. You see here. Now we're gonna have the level 3 or middle internal jugular chain. So superiorly, we're gonna have the inferior border of the iliac bone. So it means the inferior border of the 2 is the superior limit of the 3. Okay. Inferiorly, we're gonna have the inferior border of the cricoid cartilage. Okay, the inferior border of cartilage here. Anteriorly, we're gonna have the anterior border of the sternocleidomastoid muscle. Posteriorly, the posterior border of the sternocleidomastoid muscle. You see, this is very easy one. And medially, we're gonna have the medial border of the common carotid artery. Easy. So level 3 we don't separate in 3A, 3B, no. Level 4. Superiorly, we're gonna have the inferior border of the cricoid cartilage. Again, here you see the limits of one also is the limit of the other one. Okay, so we say superiorly the inferior border of the cricoid cartilage. Inferiorly is the level of the clavicle. Here, the clavicle here. Anteriorly, we have the anterior border of the sternocleidomastoid muscle. Again here, we put another color. Posteriorly, we're gonna have the oblique drawn from the posterolateral edge of the sternocleidomastoid muscle and the lateral edge of the anterior scalene muscle. Okay. Medially, the medial border of the common carotid artery. Again, the same as the level 3. You see. The lymphatic nodes we're gonna have there are the supraclavicular nodes, and also we're gonna have one very important node is the Virchow nodes. Why Virchow node is important? And this node is we're gonna find some pathology. Which one? Wow, in metastatic abdominal malignancy, we're gonna find this is the supraclavicular node. This inflammation is get bigger. It's called Trussier thing. Okay, this from the Rudolf Virchow. He was a German pathologist. So now we have the level 5. The fifth level is the posterior triangle. Limits. Superiorly, we're gonna have as a limit the skull base and the apex of the where converse the sternocleidomastoid and the trapezius muscle. You see, sternocleidomastoid, trapezius converge here. So this is our superiorly limit. Inferiorly we have is the clavicle, okay? Clavicle. Anteriorly we have the posterior border of the sternocleidomastoid. And posteriorly, there we're gonna have the anterior border of the trapezius muscle. Okay? Remember, this is the posterior triangle limit you are telling, okay? But we have two sublevels. We have sublevel 5A is the superior half, okay, this superior to the inferior border of the cricoid cartilage. See here? Remember this line? Yes, also this line gonna divide this posterior triangle in two. So this include the spinal accessory nodes. And level 5B, inferiorly, is the inferior half. Again, the superior limit is the line of the inferior border of the cricoid cartilage. I'm gonna have the supraclavicular nodes. Level 6, we have the central anterior compartment, as you see here. Superiorly, we have the inferior border of the iliac bone here. You see here. Inferiorly, the superior border of the manubrium of the sternum, or the suprasternal notch. Anteriorly, platysma muscles. Posteriorly, the trachea. Middlely, and the prevertebral space more laterally. Laterally, we have the medial border of both common carotid arteries. This space include the anterior jugular, paratracheal, pretracheal, prelaryngeal, precricoid, perithyroidal nodes. Okay. And in the end, we're gonna have the suprasternal notch or level 7 here. Level 7 here. You're gonna see here the limits. We have the superiorly the superior edge of the manubrium of the sternum, inferior the superior border of the arc of the aorta. Laterally the common carotid artery, lateral to the left and lateral to the right, the innominate artery. This is the levels of there is the 7 levels of the lymphatic nodes of the neck. This is the last classification we are using. Okay. As you can see, all these nodes are gonna have they're gonna have related with the pathology, include the area. Okay, the pathology include the area is gonna have them. It's gonna be the way they're gonna inflammate all the oral pathologies from the mouth. Gonna inflammate this node here. Pathology in the esophagus, trachea. We're gonna have the jugular, the level 2, 3, 4, or 5 inflammation. Okay. And as we say, the supraclavicular here, we're gonna have the virtual. We talk about the virtual node. It is a sign of metastasis, abdominal metastasis. So with that, we finish with the lymphatic nodes.